Hello friends, welcome to Dudier Academy. In this video, I am going to discuss with you vital signs. Please subscribe the channel and press the bell icon to get the notifications. Nursing decisions are made on assessment data, and the first time you assess a patient, record his baseline vital signs. So what are vital signs? The temperature, pulse, respiration, blood pressure and oxygen saturation are called vital signs or cardinal signs. These signs are checked to monitor the functions of the body. Then why they are called as vital signs? Because these findings are governed by the vital organs, and so it reveals even the slightest deviation from the normal body functions. The changes in the condition of the patient can be detected by observation of these vital signs. If there are any significant variations in the vital signs or in this baseline data, we can identify it can be due to any of the problems like insufficient oxygen consumption, or it can be due to blood depletion or electrolyte imbalance, bacterial invasion or any other problems. So this can be identified by assessing the vital signs. It also helps in the diagnosis of the disease, the result of the treatment, medication and nursing care. It is an important indicator of body's response to physical, environmental and psychological stresses. Then, the time to assess the vital signs. First of all, we can assess the vital signs on admission of a patient to a healthcare agency. It helps in obtaining the baseline data of the patient. Also, according to the physician's order or the institutional policy or standard of practice of the institution, vital signs are monitored. Then, before and after a surgical or invasive diagnostic procedure, the vital signs are monitored. Before and after administration of medications or therapy that controls the cardiovascular, respiratory and temperature functions. Or when the client's general physical condition changes, the vital signs are monitored. Before, after and during the nursing interventions, the vital signs can be monitored to assess the changes. If the client is reporting the symptoms of any physical distress, again the vital signs has to be monitored. When assessing the client during the home visit, it is important to monitor the vital signs. Then the guidelines for assessing the vital signs. Vital signs are monitored mostly by the healthcare professionals, and they should make their judgment by critical thinking. All the instruments used for measuring the vital signs should be in proper working condition so that it will ensure the accurate reading. Also, the nurses should have the up-to-date knowledge to identify the normal and abnormal changes in the vital signs. Also, it is important that the nurses should be aware about the variations in the normal pattern of the vital signs depending upon the age, profession, etc. Nurses should have the thorough knowledge about the client's status, history, diagnosis and treatment. Also, try to control or minimize the factors affecting the vital signs. A step-by-step procedure has to be followed in order to get the accurate reading of the vital sign. It is better to take all the measurements while the patient is seated comfortably. Prior to measuring the vital signs, patient should be allowed to sit for approximately 5 minutes so that he or she may get relaxed and we can get the baseline data of the patient. The frequency of monitoring the vital signs depend upon the client's health status. The significant changes in the vital signs must be informed to the senior nurse as well as to the physician. Also, the nurse can teach the family members how to assess the vital signs. So, the first vital sign I am going to discuss is the body temperature. So, what is body temperature? The body temperature is defined as the difference between the amount of heat produced by the body process and the amount of heat lost to the environment. So we can say it is the heat produced minus heat lost is body temperature. There are mainly two types of body temperature, that is the core body temperature and the surface temperature. Core temperature is the temperature of the internal environment of the body that include the deep tissues such as abdominal cavity and the pelvic cavity, and it remains relatively constant. The surface temperature is the temperature of the skin, subcutaneous tissue and fat, and it rises and falls in response to the changes in the environment. Physiology of body temperature, or we will call the body temperature regulation. It is mainly by two factors, that is the physiological mechanism and the behavioral mechanism. The physiological mechanism include the neural and vascular control. The hypothalamus controls the body temperature. The anterior hypothalamus controls the heat loss and the posterior hypothalamus controls the heat production. When the nerve cells of the anterior hypothalamus senses an increase in the body temperature, the impulses are sent to reduce the body temperature by mechanism of sweating or vasodilation, that is the widening of the blood vessels. Also, if the posterior hypothalamus senses the body temperature, the decrease in the body temperature, the body initiates the heat conservation mechanism by muscle shivering or vasoconstriction. Vasoconstriction is the narrowing of the blood vessels so that it reduces the blood flow to the skin and the extremities. If vasoconstriction is ineffective in preventing the additional heat loss, then shivering begins. So, the heat production mechanisms are the basal metabolic rate. Heat is produced as the byproduct of metabolism, which is the chemical reaction in all body cells. So, increased metabolic rate or BMR is also increased by the action of the hormones. Then muscle activity, that is voluntary movements like the muscular activity during exercises also help in increasing the heat production. Shivering, it is the involuntary body's response to the temperature differences in the body. Then the non-shivering thermogenesis, which is peculiar in neonates. As the neonates cannot shiver, a limited amount of vascular brown tissue present at birth is metabolized, and it is known as the non-shivering thermogenesis. Now let us see what are the heat loss mechanisms. Heat loss occurs through radiation, conduction, convection, and vaporization. What is radiation? It is the transfer of heat from the surface of one object to surface of another object without direct contact between them. Example: human body's surface area radiate heat to the environment. Next is conduction. It is the transfer of heat from one object to another object with direct contact. Example: when the warm skin touches the cooler object or applying the ice pack, heat is lost. Next is convection. It is the transfer of heat away by air movement. That is, the air current or air movement helps in the transfer of the heat. Example: an electric fan promotes the heat loss through convection. Next is evaporation or vaporization. Here, the transfer of heat is occurring when the liquid is changed to gas. Example: in our body, there is a continuous evaporation of moisture from the respiratory tract and from the mucosa of the mouth and skin. So these are the physiological mechanisms, and next is the behavioral control that include when the environmental temperature falls, the person will be adding the clothing, or they move to a warmer place, or increases the muscular activity. But if the temperature becomes hot, the person removes the clothing or stop the activity or find a cool place. So these are the behavioral control mechanisms for regulating the temperature. So let us see what are the factors affecting the body temperature. First is age of a person. First, consider the newborns. They need a warm environment because the temperature control mechanisms are not matured for newborn. Then let us see the infants. They should also be protected from extreme changes in the temperature of the environment. The children's temperature also continues to be more variable than those of adults until puberty. Older people above 75 years are at risk of hypothermia due to a variety of reasons like the inadequate diet, loss of subcutaneous fat, lack of activity, and reduced thermoregulatory efficiency. The second factor that is affecting the body temperature is exercise. When a person is doing the exercise, it leads to increased muscular activity, and there will be more consumption of carbohydrate and fat. That leads to the increased heat production, and basal metabolic rate is increased. Another factor is the hormones. Hormonal variations are more in women than men. During the menstrual cycle, there can be more hormonal changes resulting in body temperature fluctuations due to the effect of progesterone level. During ovulation, there will be increased progesterone that leads to the increased body temperature. But in menopause, body temperature increases, which is developing as hot flushes in menopausal woman. Another hormone that is responsible is the thyroxin, which increases the rate of cellular metabolism throughout the body. Epinephrine, norepinephrine and the sympathetic stimulation increases the cellular metabolism in body tissues. Next is circadian rhythm. The fluctuations of the physiological and the behavioral parameters over a 24-hour cycle is considered as the circadian rhythm. That is, in 24 hours, the body temperature is getting fluctuated rather than remaining normal. That is, almost 0.5 to 1 degree Celsius fluctuations can be seen in a 24-hour period. Normally, the body temperature is getting lowered between 1 am to 6 am, and during the daytime, the body temperature rises steadily and maximum reaches at about 6 pm. Next factor that is influencing the body temperature is the stress level. What happens during stress? The sympathetic nervous system is affected, that leads to changes in the hormone level. That is, the hormones like norepinephrine and epinephrine is increased, leading to the increased metabolic activity and heat production. Next is environment. The changes in the environmental temperature can affect the temperature regulatory systems. Example, if the temperature is assessed in a warm room, the temperature will be elevated for that patient. Also, if the temperature is assessed in a cold weather, the temperature will be low. So these are the environmental factors that is affecting the temperature. Now let us discuss what are the sites of taking the body temperature. It can be divided into commonly used sites are oral, axilla, rectal and tympanic membrane. And some of the other sites include the temporal artery, vagina, urinary bladder, etc., which are not commonly used. First is the oral site. Usually, the thermometer is placed under the tongue, that is sublingual. Temperature within the lingual arteries under the tongue are monitored. What are the advantages of taking the temperature through oral site? It is most accessible, provides the accurate surface temperature, it is comfortable for the patient and it requires no change in position. So it is a most accessible site is oral site. But it is having certain limitations because it is affected by smoking or drinking hot or cold liquid oxygen administration. Also, we cannot use this type of method of assessing the temperature in patients with oral surgery or trauma or history of epilepsy. We cannot use this method for infants, small children, confused, unconscious patients because of the chance of biting the thermometer. And another limitation is body fluid exposure. Next is the axillary temperature monitoring. The thermometer is placed in the armpit of the patient. That is, the bulb should be in the center of the axilla. So what are the advantages? It is safe and easily accessible and comfortable for the patient. It can be used with newborn and also unconscious patients. It is a non-invasive procedure, so there is no exposure with the body fluids. The limitations of this type of axillary temperature monitoring include it needs long measurement time compared to the other methods. It is less accurate, that is, no major blood vessels are nearby, so it is less accurate, and there is chance of getting false reading as the axilla is mostly moist from sweating. Next is the rectal method. The side-lying position with upper leg flexed is used for introducing the rectal thermometer, and the advantages include it is most accurate, very reliable method because the rectum contains large amount of blood supply. Also, we can use this method if oral method and the axillary method is contraindicated. But it is having the limitations, that is, it is not used for clients with diarrhea or any rectal surgery, rectal problems and bleeding tendencies. Another disadvantage of rectal method of assessing the temperature is it requires the positioning. And also it is a source of anxiety for the patients by introducing the rectal thermometer into the rectal area. Impacted stool influences the reading. Also it requires lubrication for introducing the thermometer into the rectum. Another disadvantage is there is chance of soiling the hands of the nurses. Next is tympanic membrane or ear. The thermometer is introduced into the ear. Advantages include it is convenient and readily accessible. It is safe and non-invasive method. It does not require contact with the mucous membrane. And it can measure the core body temperature and shares the same arterial supply as hypothalamus. But it is having the limitations. If there is any ear infection or cerumen, it affects the reading. And we cannot use in clients who had surgery in the ear. Another important point that we have to remember is we have to remove the hearing aids before reading. Let us see the normal values of body temperature. It is measured in either Celsius or Fahrenheit scale, and the average oral or tympanic temperature is 98.6 degree Fahrenheit or 37 degree Celsius, and the rectal temperature is 99.6 degree Fahrenheit or 37.5 degree Celsius, which is the highest value, and the average axillary temperature is 97.6 degree Fahrenheit or 36.5 degree Celsius, which is the lowest. We can also use a formula to change one scale to another. In order to convert the Fahrenheit scale to Celsius scale, we can use the formula C is equal to F minus 32 into 5 by 9. So here I have given an example to convert the 104 degree Fahrenheit to Celsius. So C is equal to 104 minus 32 into 5 by 9. So we will get the answer as 40 degree Celsius. Similarly, we can convert the Celsius scale to Fahrenheit scale. For that we use the equation F is equal to C into 9 by 5 plus 32. In order to convert 37 degrees Celsius to Fahrenheit, we can use the formula C is equal to 37 into 9 by 5 plus 32. So we get the answer as 98.6 degree Fahrenheit. So I hope you understood what are vital signs and the first vital sign, temperature. Thank you. Please subscribe the channel and also like, comment and share to your friends.